What aspirations do you have for your child? Musician, singer, actor, leader, athlete, or engineer? The truth is, everyone's life is better when they are attractive and healthy. Optimized forward facial growth through proper breathing and correct oral posture delivers improved life performance in every way, from a higher IQ to higher cheekbones and naturally straight teeth. It also helps avoid a raft of downstream poor health consequences such as are listed here. From the moment a butterfly emerges from its chrysalis, it works to unfurl its wings and fuse the two parts of its long tongue so that it can suck up and absorb the liquid nutrients it needs. In other words, a butterfly must work to attain the functions it needs to survive. Similarly, infants and children need to work to attain the maximum function they need for optimal health. The attractiveness we all want offers health benefits in surprising and far-reaching ways. All cultures value beauty. Attractive babies receive more affection and are more likely to grow up into well-balanced adults. Attractive people are perceived as being more intelligent. In fact, they actually often are more intelligent, possibly because they receive more attention in schools and elsewhere. They are also more likely to get better jobs, rise to higher positions, and earn more money. An attractive criminal is more likely to receive a shorter sentence from a judge. Unattractive people are more likely to become criminals. Handsome cadets achieve higher rank by the time they graduate. Surprisingly, beauty often results from developing a clear airway from birth. Unobstructed breathing brings immeasurable health benefits. Body chemistry changes significantly when one has a compromised airway. You may have found my work because you want your child to maximize their beauty genes. You have also learned how a square jawline with forward facial development keeps the jaw and tongue from choking off the airway, especially at night. You can't miss how the people we enjoy watching have a squared jaw with the jawline nearly parallel to the floor. Notice also the high cheekbones and wide noses that indicate these icons have unconstricted nasal and sinus spaces. The roof of your mouth is the floor of your nose and the base of your cranium that houses your brain. You want to develop as much room as possible for your tongue, adenoids, throat, sinus spaces, eyeball orbit, and brain. This person developed and was orthodontically treated, far from optimally. Myofunctional therapy is all about increasing oral volume. You are working to build an SUV-sized garage for your SUV-sized tongue. Way before choking attributed to apnea threatens health, its precursor snoring challenges relationships. This video clip shows apnea can be a serious problem even when one sleeps on his side. At this point, you can see the man is struggling to breathe but is unable to move air for a few moments. The struggle often pulls acids from the stomach to cause reflux and erosion of the esophagus. But it is the squirt of cortisol that adrenal glands make every time a person stops breathing that leads to high blood pressure and deranged blood sugar, cholesterol, and hunger hormone levels. In this way, diabetes, heart disease, stroke, and obesity commonly influence and reflect the nighttime choking sessions. Children and thin people are not immune. Most people have no clue they have apnea. The most significant oral posture to develop is an upper tongue rest. This means your tongue is plastered front to back to the roof of your mouth. The tip is on what we call the spot, about 1/2 inch back from the top front teeth and behind what we in dentistry call the incisive papilla. The incisive papilla is rich in nerves. When the tongue lifts up, it stimulates these nerves, which in turn stimulate the brain. For developing children, the tongue is the template around which upper teeth erupt. The teeth should comprise a neutral zone wherein the tongue muscle pressure counterbalances the opposing cheek muscles, particularly during sucking. As the tongue presses against the roof of the mouth, especially during a swallow, it rubs on the midline of the palate and stimulates the stem cells there. This line of stem cells can be thought of as a growth plate that widens the jaw, kind of like the underwater volcanic chains that expand ocean floors. For those who have had orthodontics that include a palate expander, think of the tongue as a natural palate expander. As you may know from reading the Facial Meltdown article on my blog, there are 3 major oral postures you should develop. The first is to keep your lips sealed together while not using them during eating or talking, partly so they act as a natural retainer for the front teeth, and partly because this keeps your lower jaw from dropping. Check to see that the tissue that anchors the upper lip, called the labial frenum, is not too thick or attached so low that a person can't comfortably keep a lip seal. This situation can lead to a space between the front teeth that can't close, an inability to move the upper lip as well as one should during normal activities, and can contribute to gum inflammation as air passes constantly over them. The second is strengthening your tongue and supporting muscles so your tongue can nestle front to back in the roof of your mouth. These two together ensure proper nasal breathing. Do you see how the tongue of these birds maintain the shape of the upper beak even though their mouths are open? Up is their correct tongue position too. Swallowing correctly is the last skill. You should not activate your lips or chin muscles. Your tongue remains firmly suctioned to the roof of your mouth. Only the very back portion of your tongue lifts. It does not move forward at all. Be sure that if you are interested, you have also accessed the studies attached to my article, Why Do We Have Crooked Teeth? They relate myofunctional therapy to more comfortable and functional jaw joints, better heart function, less snoring, and as an adjunct therapy for the killer functional problem doctors call sleep apnea. You may have learned to rest your tongue on the floor of your mouth and swallow incorrectly because you were bottle fed, used a pacifier, or sucked a thumb or other finger. Incidentally, if you choose to transition your child to drinking from a glass by using a sippy cup, OXO sippy cups would be your best choice. Use these only at mealtime for a short time. They are only a transitional item to help a toddler learn to drink from a glass. Fill with water only so you don't reinforce the joy of drinking from these. You may have learned to mouth breathe because you have unaddressed allergies. You can't breathe through your nose if it is stuffy. As I've written elsewhere, wheat and dairy are the most common yet unrecognized allergens. Don't forget, though, that the more you mouth breathe, the more congested your nose will be, since the nose will try to stop carbon dioxide loss by narrowing down the nostrils with mucus. It doesn't realize your mouth is a downstream leak. If a child can't breathe through his nose because it is stuffy from allergies, his only option is to breathe through his mouth. Constant cracked or dry lips is one clue your child is not keeping his lips sealed. Drooling during the day or night is another. Of course, if your lips are sealed at night as they should be, you won't be finding drool on the pillow the next morning. As a person has an open mouth posture, to create a maximum airway, the upper lip shortens and the tongue drops down and forward. The upper jaw drops down and back, and muscles and nerves change. Skeletal features change also, as I introduced in the Facial Meltdown article I posted on my blog. To begin therapy, test yourself to be sure you can take 20 good nasal breaths. An often overlooked reason people have a lower tongue rest is when the little string of tissue that anchors the tongue to the floor of the mouth is too short, it is attached too closely to your tongue tip, or attached too closely to the front of the floor of your mouth. When considering treatment, it is good to know the frenum is nothing but the vestiges of embryonic tissue. It has few nerves and little blood supply. Midwives sometimes relieve this to some degree so babies can nurse, though when a complete release is needed, it is not a do-it-yourself project. Tongue tie releases are so medically essential in order to enable children to learn to swallow correctly and develop optimal phases and airways that Brazil has mandated all children be checked and, if necessary, treated for tongue tie. You can see by looking at these images that it would be impossible for these tongues to form a vacuum seal with the roof of the mouth, which is necessary for optimal development, or to move in other ways most effective for sucking, eating, or swallowing. Middle tongue or posterior tongue ties are among the most subtle. Oftentimes you can see it as a depression in the middle of the tongue, as you do in this one. Sometimes you can tell by sticking your tongue out straight and moving it from side to side. Is the movement crisp, and does the top of your tongue stay facing up, or do the edges roll and loll like a beached whale? This person needed a tongue tie release and was effective partly because he carefully followed a specific therapy regimen beginning immediately afterwards. Without this, reattachment and scar tissue can result. To determine if you need a release, a therapist will measure the distance from the tips of your top front teeth to the tips of your bottom front teeth with your mouth fully opened. She'll call that letter X. She'll make the same measurement with your tongue tip on the spot and call that number Y. In order to move forward successfully with therapy, the second measurement Y should be at least 60% of the first measurement X. In other words, she will multiply the first measurement by 0.6. Y must be the same or greater than this answer. It is possible to move forward. You can only open half of the distance because muscles of the tongue can stretch, but your results will likely be less effective. There are several issues you must address before you move forward with myofunctional therapy. First, of course, is a tongue tie, such as I've discussed. Be sure you are ready to begin the post-release exercise immediately after your release, so scar tissue doesn't leave you worse off than you started. Addressing allergies is also critical. If stopping the most common allergens, such as milk and wheat, doesn't work, know that many people have very successfully used the Nabudripod allergy elimination technique known as NAET. If your tongue is scalloped like this, your therapist likely insisted on a sleep study prior to therapy because a scalloped tongue indicates your tongue is trying to move out of your airway at night so you can breathe. Apnea has so many terrible health consequences, it is essential to know when you have successfully treated the airway obstruction. This is what some call a collapsed upper arch. If yours looks like this, it will be difficult for you to tone your tongue enough to allow it to nestle in between the confines of your molars. You will probably need an orthodontic expansion before you move forward.